Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evan Zug, also known as The Doc Dudes.
All right, welcome to another episode of The Doc Dudes. I am Garrett Harper with my fellow physicians,
Robert Graper
and
Evan Zug.
And today we have such a delightful, wonderful co-host with us. She is one of our aesthetic injectors who took on a role that I kind of presented to her, 6 months ago, a year ago, and she's really just taken the bull by the horns and run with it, which is hair restoration, and then the many different applications of what first was PRP that we were using in the office, and then that kind of morphed into PRF, and we'll talk a little bit about the difference in those things, but I would say this is probably the one time where Google MD is probably smarter than the doctors that are sitting at this table right now when it comes to this matter. And then most recently, exosomal therapy, which is, I guess, the next frontier, Kristen, wouldn't you say? So we've got Kristen Hall with us, and for the audience and any patients that are listening, of course, you see her all over our social media. She's a wonderfully talented nurse injector who has broadened her practice even more by taking over the reins for hair restoration and then other applications of PRP, PRF, and exosomes. So welcome, Kristen.
Thank you for having me.
Yeah, absolutely. So tell us a little bit about yourself. You can start. Your Boston Celtics won the NBA.
We have another title.
Championship, you do. And so tell us a little bit about yourself, where you grew up, what you do, and what you love to do. And
Well, I am from Boston, Massachusetts, but I've been I've been in Charlotte for the last 17, 18 years.
Wow.
And I've been here at Graper Harper for 9 years.
Yeah.
So really, I started pretty much when I graduated nursing school. 6 months out of nursing school, Dr. Graper gave me a job.
And then, when I started, like right after you, you kind of split time between being one of our OR nurses and got so busy and so talented at injecting that it was just a poor waste of her abilities to keep her back there with you and I. That's exactly right. So she has been injecting ever since. But married, has a son at Providence Day.
Yep, 16 years old. He's driving.
Yeah, I know how that feels.
And life is going fast.
Yeah, I know how that feels. Okay. Well, let's jump in. We've talked before on the podcast about fillers, Botox, that kind of stuff. We can certainly, if, Evan just brought something up, actually, so we can kind of throw some miscellaneous questions at you here at the end. But let's talk a little bit about hair restoration, which I can speak on behalf of my own experience, but let's lay a little foundation for patients and let them know kind of what PRP and PRF is and how we get that in order to be able to use it as a therapy for patients. So what's involved when somebody comes in and says, men or women? I mean, I think we see a ton of women for this now too, right?
Yes,
and it's not just hair on your head, right? It can be eyebrows.
Yep, eyebrows.
And beards.
And beards.
Yeah, and so I think pretty much everywhere else, everybody likes to have as little hair as possible, but certainly for beards, eyebrows, and hair, that's what you want. Okay, so somebody comes in and says, I'm getting older, my hair's thinning, I just want my luscious locks back. What do we tell them?
Well, we have I do go through their medical history, make sure that they're healthy, see what's going on with them, and then go through the PRP process. It's platelet-rich plasma, which we will draw your blood, we'll spin it down, we get that liquid gold.
Okay.
And then what we do different here is we'll take that and we'll turn it into platelet-rich fibrin matrix, actually, PRF.
Right. So either one of those, the PRP or the PRF, you're sticking me.
I'm sticking you.
With a needle.
Yes.
So if it's Graper, he hates needles, so I got to hold him down.
Yes.
Right?
Wait a minute.
All right. Right. And so platelet-rich plasma, right? When we say we spin it, you're going to draw blood, and then that goes into basically a little tube, a little container that has its matrix in there, the fibrin matrix, which can kind of catapult these growth factors and stem cells into being able to do even better work.
Yeah, what we do when we have that, when we inject the PRF, what we're doing at that injection site is we're allowing those platelets to stay there for 7 days, the life of the platelet.
Okay, so it just kind of holds it in place.
Holds it in place.
Like literally, it's just kind of like a topical dressing, holding the medicine where it needs to.
Right.
So that you don't go home and wash your hair that night. And
so there is a protocol of for 24 hours, you're not going to wash your hair.
Okay.
For the next 72 hours, you're going to be gentle, you know, working out, heavy, swimming, heavy sweating. You want to be gentle. You don't want to disrupt it because it can be unstable for 72 hours.
All right. And so.
But when you said there's a bandage, you mean there's an internal scaffolding that's holding this platelets. There's no external band.
Correct. But like this thing spins down, right? So when we say spin, we put it in a centrifuge.
Yep.
And that's like, what's the tilt-a-whirl?
Yeah.
You know? Remember that?
The octopus.
Right. So you get in that thing and it spins it up, and then it kind of, things fall. It's like a sedimentary thing, and things fall according to, I guess, their density. And so what we're able to do is take your blood and get rid of the red blood cells.
Yeah.
So we're basically just keeping all the nutrition for the red blood cells that it bathes in.
Yes.
We're taking that. So it's platelet-rich because the platelets are still there. And then plasma is basically the solution that's around our red blood cells in our blood. So you take that, and then you're going to inject that.
Well, we have another step. So once we get the plasma, we have another tube that has calcium chloride in it.
Okay.
And so that, when we transfer it into that tube, that is what starts the matrix.
Okay.
So we do have to inject it within a certain time.
Okay.
Because it will start to congeal.
Okay.
So that, think of that. That's what's actually doing when we inject it.
It's wild.
It's pretty cool.
All right. And then are they done? Like you just kind of inject them and they're like, oh, okay, I'm just start growing hair. Like what happens?
No, we'll inject them, but I also use a little vibrator to trick that nerve so it's not as painful. The first time's typically the hardest. And then after that, everybody gets through it pretty good.
All right.
You're going to come back between 4 to 6 weeks.
Okay.
And then you're going to do about 3 treatments.
Okay.
We also, we started our protocol in this office where we're putting everybody on the youthful vitamins.
Okay.
And we do that because that helps, keep the hair shaft from breaking. It's a bunch of vitamins, keeps the hair shaft strong.
Specifically, scientifically tested to try to fortify the hair follicle.
Yes. And then the PRF will help the hair grow.
All right. So that kind of induces the hair growth, but we're setting up an environment. It's like when you're planting a garden, right? You want to use like good planting soil, right? You can throw all the fertilizer you want, but if you got old Georgia red clay, hard dirt there, nothing's going to grow, right? I know a thing or two about Georgia red clay.
You look like a redneck farmer to me.
I know. My wife says I need to shave my beard, so I'll get on that today.
And then we also do the drops that you've compounded for the practice.
Right.
The minoxidil.
Right. So, and I think that's important. I think that if you're really going to go after this, it's almost analogous to what we talk about with filler, right? Yeah. When somebody says, filler just didn't work on me. Filler works on you. Maybe you didn't do enough. Yeah. And that's kind of what the scenario is with hair, is that I felt like I was seeing some patients before that they were just doing the PRP and they were getting results, but it just wasn't like wow factor. And so the more we kind of researched it here, the more we realized that you've got to do the additional adjunctive things, right? You've got to do the Nutrafol. There's a shampoo that Nutrafol has as well, a shampoo and a conditioner.
And people are starting to see results,
right.
After the second treatment. And since I've started doing it in January with this protocol, our before and afters speak for themselves.
Yeah, they're awesome.
I mean, they are awesome.
Yeah, I will say
but which patients are not candidates for this? Like male pattern baldness? I mean, is anyone a candidate? Is anyone going to see improvement?
Is anyone too far gone?
Well,
that's kind of what I'm asking.
You're looking at me.
It can, it helps activate the follicles, and it can help activate the follicles that are not active. It's not going to create a new hair follicle. So even if you do have that male pattern baldness, it can make you full. What I've seen is that it gets thicker, the hair gets darker. So, I mean, it just keeps getting better. Every time I take a before and after, I'm like, wow, this is really.
And I think to Evan's point, there are patients that are like, there are contraindications for it, right?
Yeah.
I think a lot of times they talk about cancer patients and things like that, and maybe even patients that have some autoimmune diseases and things like that. And
if you're on, clotting, if you have.
Oh, that's right.
APL, I think it's called,
right.
So there are some things that.
Right. And so we'll make sure, and that's part of the history taking that you do, and just make sure that they're a good candidate. And then the drops were kind of the third component to this, right? Like, so you've got the PRP, PRF injections, and then you've got the vitamins, which by the way are like 4 vitamins a day, and they're like horse pills. Those things you really got to pump yourself up to take them, but they work.
And, with anything, I mean, this is kind of, people ask, how long do I have to do it?
Right.
And so once you do the treatment of the PRP.
I love that question as a plastic surgeon.
Yeah.
Isn't that great? How long do I have to do skincare?
Forever.
Yeah, exactly.
But it is like working out. So the vitamins, they're there, for life.
Right.
It is. It's like working out. And the PRP, once you get through the treatments, and you'll start to see your full results, 6 to 9 months after.
Sure.
And then the maintenance plan is really twice a year.
Okay.
And it doesn't hurt you to do it 3 times, 3 times a year, 4 times a year.
Just spread it out. But you're just not going back to back every 4 to 6 weeks. Right. So you can kind of really spread it out. But it's like one of those things where for the vitamins and for the shampoos, it depends on how much you want to nourish your hair follicles, right? Yeah. It's anything in life.
How many treatments do you have to do till you get to that maintenance phase?
You have to do at least 3. And, so I'm seeing patients back every 3 months. And then after the last time I do the injection, I'll say, all right, we'll decide, 6 months from now, we'll get your final pictures. We'll see, is it of value to you to continue with it? And you'll see the benefits, and is it of value? And if it's of value to you, then we'll do it twice a year. You stick with the vitamins, it can be a lot for people.
Which is similar to Botox and fillers, where it's like you have to make the decision. Do you like what it does for you? And if it does, then you keep doing it. Yeah. You budget it in, and that becomes like kind of part of your standard care. So should we stop saying PRP? Like, are we just doing PRF here now? Is that basically like...
Yeah, we're just doing PRF.
Okay. And which is basically a combination of PRP.
Right.
With this really nice kind of gelatinous matrix that's going to hold it in place.
The PRP just goes through your body within 24 hours.
Okay.
You know what I mean? It just, it just doesn't do everything that the PRF.
Yeah, and PRP has had applications in all sorts of areas of science and medicine.
Oh, yeah,
that's where it started.
Yeah.
That's where it started. And I remember kind of my ears kind of perked up about this when a guy that lives a couple houses down from me, his father-in-law is actually a plastic surgeon in Oklahoma City, and he sprained his ankle really bad. I mean, ankle swelled up like crazy. And so they were out in Oklahoma City, and his father-in-law like drew up PRP and injected it in his ankle, and he's like, oh my God, that was like better in 24 hours.
Yeah.
I was like, that sounds kind of crazy. But like there really are healing properties to this. And, our before and afters, obviously you want to see whoever is doing the injections to make sure that they're following protocol. But the third arm of this, I kind of left off, is the compounding the formulas.
Yes.
Right. And so that's something where they're drops. They can come in drops. I actually bought these little kind of spray tubes that are maybe 5 millimeter spray tubes off of Amazon, and they'll ship you like 20 of them. And you just I pour the solution in there.
And just spray it.
And then I spray it. And so that's just a little bit easier to maintain. Actually, really funny story. You'll love this story. So I think I did my first round of this starting right before COVID, right? I mean, yeah. And I remember you were walking around the office, Dr. Graper, like December of 19, and you're like, I don't know, because your son is in finance and kind of has an ear on the Chinese market and all this kind of stuff. And you were like, I'm just hearing that this, it's going to be bad. There's going to be this flu, and I think we're going to have to shut the office down. I was like, are you crazy? Like there's nothing in the world that could shut down. And what is America? I mean, okay, well, that didn't happen. But I had already started the drops, right? And so what I did was I'd take my shower, I would use the shampoo, and then I would just kind of freehand drop it. And it was really my balding was like a receding hairline. And so it's kind of the front of my dome, it's not like way back in the back. And some of it would obviously like kind of roll down my face and I would wipe it away, right? And so I grew a mega beard. Kristen Hall and I did a video at the end of COVID. Do you remember that?
Yes.
Liposuction versus cool sculpting. I mean, I had like Duck Dynasty beard. That thing was awesome. What I didn't realize was at home, I don't have we have sconces in our bathroom. So I don't really have like great lighting to my mirror. And I came in to work where we do have really good lighting in our bathroom. And I like leaned forward to wash my face or something like that. And I had so much hair around my eyes. I mean, I was like a werewolf. I could not believe it. I went home to my wife. I was like, you didn't say anything? Yeah. Oh, that's exactly what it was like. It literally was in a night. I mean, it was up in like my lower eyelids. I mean, like a wolf pack.
Werewolf of London.
That's not right. It's right. So then what I decided to do is I was like, okay, I'm going to look really cool and I'm going to buy the NBA headbands. And I literally bought like the red, white, and blue ones, like Jerry West on the front or whoever's on the front, like whoever that is. And so I would put that on and then I would do the drops so that it would catch it before it got down my face and gave me hairy eyes because that wasn't really that attractive. And then I kind of took the next step and bought these little things on Amazon. So now I just spray it into the area, and it's way, way easier. So for people listening, if you're having problems like, oh my gosh, the drops are going everywhere, I'm getting Mrs. Hairy Face or Mr. Hairy Face, you can either buy the headband, which looks stellar at night. My wife's like, hell yeah, you're looking great. Keep that on. That's awesome. Or just do the little sprays. And so, and there are different spray formulas for men and for women, right? Because they're going to have there's different reasoning for alopecia or for thinning hair for those people. So they don't quite need that, 5-DHT, whatever. They don't quite need that. So there's different formulas for men and women, and we'll steer you in the right direction. And if you want a hairy face, you can do it however you want, but that's basically it. Okay, so we talked about some of the areas, the most popular areas. Obviously, we're going to be at the top of the head. Mm-hmm. And then we talked a little bit about the process and the technique. Let's talk briefly about exosomes, right? Because this is like the next frontier.
Well, let's talk a little bit where we can also put PRP besides the hair.
Okay,
because we're doing a lot of PRF in the under eye.
Okay.
And the thought process.
Sure.
Well, PRF can help heal, and it helps with all those growth factors.
My wife's done it, and she loves it.
Yeah.
She actually likes it better than filling the tear troughs with filler, which has gone awry in Hollywood, apparently.
Well, I think we're going to see us moving away from doing filler under the eye and doing more this approach more. And if you address the issue with most people, and it's usually the cheek, the mid cheek that needs support. And once you support the temples, the cheeks, you most likely don't need the under eye. But where the skin is thin, and you have that wrinkling under there, that's really hard to get with Botox. Right. PRF is really starting to pick up speed.
I think a combination of PRF and Denza, our radio frequency machine. The application for Denza is so great under the eyes. I mean, I just feel like everybody could get periocular Denza, and it's going to continue to grow collagen and mount collagen over 6 to 9 months, and it's just one of these things that you see a little bit of improvement immediately because there's those two different levels, monopolar and bipolar radio frequency that it delivers, but the long run is what you're looking for. So by the time you improve, fertilize the grass, like what you're doing with PRP, PRF, and you're taking care of the skin in that area by kind of shrink wrapping it with the Denza, I think is an awesome way to rejuvenate the eyes without having to do surgery, which is great. And I only say that because I'm glad you brought up the eyes. I've recently, for whatever reason, whatever kind of comes through feeds, they showed, I guess, a recent Jennifer Aniston kind of video and like a couple other celebrities, and it was like scary. I mean, look like they gotten socked in the eyes. They just didn't look like the same people.
Yeah, it makes sense. I mean, with filler, you're camouflaging the problem. What's the problem with the under eyes? Why does it look bad? Because the skin's so thin.
Yeah.
Mm-hmm.
And then as we age, so we're thickening the skin and giving it more blood supply and tightening the skin.
Right.
We're treating the actual problem instead of camouflaging it.
Right.
It's awesome.
Right.
I'm going to push back on that.
Push back.
Well, at a certain point,
Are
I
we
think
talking about skin
needed.
quality, or are we talking about the fat that's herniating out of the lid?
Totally different.
Yeah, so if it's skin quality, that would make sense.
Totally different. So somebody who needs surgery who has like eyelid bagging and needs a lower bleph, no doubt about it. But even when we do a lower bleph, right, we try to blunt that tear trough by releasing those retaining ligaments around the orbital rim. You know, so you are trying to, and I zap the bag. I remove a little bit of fat. I definitely don't remove as much fat in lower blephs than, say, I did 5 to 10 years ago. And I just kind of try to zap that bag, try to release those little orbital retaining ligaments, and then, you know, do your canthopexy stitch, and then a little bit of skin that gets removed there. But we're talking about the person who may be kind of pre-surgical and just says, I always look tired. I always like my eyes are just.
So you're still
sunken
camouflaging. Filler camouflages the PRP.
Yeah, but I think we're getting away with this. I think the PRP actually is going to strengthen that skin and improve the skin quality.
The septum, and then it wouldn't need the bleph.
Yeah, true.
I mean, how cool would that be?
That'd be great.
Cool.
Yeah, we'll invent that.
Yeah.
And then I'll retire. All right, so that's another application. My wife has done that, loves it, obviously. But let's talk a little bit about exosome therapy.
Right.
All right, because that's kind of the next frontier. And I would say that, you know, as far as studies go, because this is, we're very science-backed here, you know, the most amount of studies are going to be on PRP, right? And then next is going to be PRF because it's just kind of newer, right? But I mean, there's tens of thousands of studies on PRP and all the different applications and how it helps. Exosomal therapy is going to be a little bit, you know, different. The positive with exosomes, without saying it's more powerful, the positive is that you don't have to draw blood, right? So, I mean, this is either synthetically made or it is taken from a donor, right? Yeah. And this is exosomal therapy that have similar applications, and they're kind of in the process now of seeing how much better. What's the efficacy? How does it kind of compare to PRP, PRF? Of course, the exosomal people will tell you it's 1,000,000 times better. The PRP, PRF people will tell you we've got so many more studies. Like, this is all anecdotal things, but we've used the exosomes here.
Yeah, we've used a little bit. No, we're using it on the face with microneedling.
Right.
There is some exosomes that are specific for hair. You know, so that's what we've done on you, your mom, your wife. And so we're still, you know, seeing how
Love you.
seeing how that's all going to turn out.
That's right.
So we are doing it in-house to see how to compare it towards PRF.
Right. Right. And so, and it looks promising. I mean, it's still one of these things that you still have to maintain the garden. You still got to do all the other things that we talked about. It does save you the blood draw, which is great. I don't know about from a pricing standpoint where exosomes.
It's pretty much the same.
Similar.
It is, yeah.
Yeah, similar. And then there's different ways to get exosomes, right? And so there's, as this is becoming this huge industry for regenerative medicine, we're starting to get a bunch of different companies that come in here that tell us why their exosomes are better than others, right? Like maybe their donors are more youthful and younger and just better genetics. I don't know. And then there's total synthetic exosomes that are kind of coming out now,
that's the newer, the platelet-derived growth factor by Ariessence. That's the new one that's hitting the market. Yeah. That is not human-derived, but all regenerative, and it's pure, and it's supposed to be the most potent, predictable. Yeah. Every time you do it.
Yeah. So, you know, I applaud you. I think you've really done a great job. Your before and afters are stellar. I've had several patients that have kind of stopped me and and have done our new protocol and just kind of talk about how much better their experience is and how much better their results are. So that's really, really great. And I'm glad that you have taken the initiative, because this is something that you're the only one in the office that's doing the injections. Like you said, our estheticians are using exosomal therapies with microneedling, which is a great way to deliver the exosomal therapy. And that's akin to vampire facials. Remember when vampire facials 10, 15, 20 years ago were the whole rave, right? They're taking your blood and making little holes all in your face, and then you wash your face with it and lather it all up in there. Well, this is a little bit more scientific than that, which is great. So estheticians are using it. You're using it from an injection standpoint. I'm receiving it from an injection standpoint.
What's your experience? We've been talking about the theoretical, and I'd love to see Kristen's results, but what's been your experience?
It's been great.
And I want to see your before and afters.
It's been great. I think that...
Just your hairy cheek?
Right. My cheeks definitely grew it like crazy. And then, I mean, you can just tell when you are following the protocol, right? When you are doing the drops, when you are taking the Nutrafol, when you are consistent with getting in Kristen's chair and getting the therapies. That's right. It's wild. It's awesome. I mean, Lindsay's doing it, and a couple other people here in the office are doing it, and they just can't believe how much stronger their hair is and how thicker. And then they point out all the little baby hairs that are coming in all these places.
I mean, I'm enjoying it more than I thought.
That's awesome.
I will say that, because I honestly love doing the injections.
You didn't need anything else on your plate, but I'm glad that you took control of this.
And I have, every time I do a before and they come in for their after, you know, I'm like just as happy and pleasantly surprised as they are. I'm like, this is going to be
tangible.
Yes, I'm
result.
like, this is good.
I know.
They're like, can I take a picture of that? I'm like, absolutely.
And then you like push their befores in their face, and then you feel like you're like, they don't want to see that. All right. Well, if you have any questions or topics you want us to cover, visit ghsurgery.com. Click on the Doc Dudes from the homepage. There's a link to click to submit your questions and ideas. You can also listen to all the Doc Dudes episodes on your website, as well as Apple, Spotify, YouTube, anywhere you listen to your favorite podcasts. Follow us on Instagram and Facebook to find out when new episodes drop and other information about our practice. I can't thank Kristen Hall enough, for being here. It's great. But that's not really what I'm thanking you for. I'm thanking you for like investing time and, you know, your kind of heart into this, because, you know, you were plenty busy with what you were doing. So taking on this responsibility really trying to learn about it, I think has been awesome to watch. And I love hearing all the positive feedback that I'm getting from patients, because a lot of it are my friends and dudes that come in here.
Your wife?
That's right.
Your mom.
My mom. That's right. Hey, Mom, love you. Exactly. Love you too.
No love for Kristen?
Love you too, wife. She knows that. I tell her that all the time. I don't tell my mom that enough, right? All right, but thank you very much. This is another episode of the Doc Dudes. I am Garrett Harper. This is
Graper.
This is
Heaven Zoo.
This is
Kristen Hall.
All right, thanks, guys. Bye.